Until further notice, meetings of the Board of Health will be held electronically with a majority of members participating via remote access in order to comply with the State of Illinois gubernatorial disaster proclamation. Members of the public who wish to notice, meetings of the Board of Health will be held electronically with a majority of members participating via remote access in order to comply with the State of Illinois. I'm getting feedback, Mike.
Yeah, you should be good now.
Okay. To continue, members of the public who wish to comment as to an item on the published agenda must submit their statement or question in writing to Michael Charlie with the Skokie Health Department, and all properly submitted statements or questions will be presented and read during the relevant portion of the meeting. Written comments may also be submitted by mail to public comments at skokie.org by mail to the Village of Skokie. Attention, Mike Charlie, Director of Health and Human Services, 5127 Oakton Street, Skokie, Illinois, 60077, or via the Village's Dropbox located by the Village, the public entry to Village Hall. And with that, we'll defer with the approval of the agenda or the minutes. I just have a very brief chair's report if you want me to go ahead with that.
Please do.
Okay, and this is for information only. I don't have any action items. But Tuesday night, PBS started a series called Extra Life, A Short History of Living Longer. I don't know if any of you had a chance to view that, but the first episode was on the history of vaccination. And I thought it was very interesting, going back to, Maureen, did you see that? Yeah, and it goes back to the time of Jenner and the smallpox vaccination, and some of the things that were problems back then are problems now in terms of the equitable distribution, people refusing to be vaccinated, and it brought it forward until our current time, including the development of the mRNA virus. So if you can find that on demand, yeah. I would recommend
I saw the part about Fauci explaining sequencing and another gentleman who talked about smallpox and eradication of smallpox. Those are the only two parts I saw, but they were very informative.
Very well done and presented, and very, very understandable.
Yes.
It took over 200 years to eradicate smallpox. And
right.
Yeah.
They were clear about that.
You know, at the COVID clinic today, there was some discussion about how reconstituting the Pfizer vaccine takes several steps. And I reminded me of when we were doing smallpox vaccination in the office with the vial that you had to reconstitute, and then the two-prong needle that you counted and made the circles all around someone's arm. I'm dating myself, but some of you may.
I got.
Hey, Dr. Warner, what was the name of that series? I just missed it when you said it.
It was Extra Life, A Short History of Living Longer. And the premise was in 100 years, we've doubled our lifespan from like 35 years to over 70.
Can I make a recommendation? The PBS has a really wonderful app you can download onto your streaming devices, and you can access all their programming. And it's very stable and it works very well. And so you should be able to find it.
Don't you have to be a member and donate a certain amount of money to get access to those?
If you're a member and you donate some money, you get their higher level, which allows you to go back and look at older programming. But the more recent stuff you can usually get without that.
The streaming.
The other thing that caught my attention, I'm registered for a webinar with the National Academy of Science and the American Public Health Association. And this is next week. And the title is Learning to Live with COVID-19, with a focus on what life with endemic COVID-19 might look like, including the realities of managing future outbreaks and the ethical and policy challenges that will need to be navigated by the leaders. And these are open to the public. You can find this on the National Academy of Science website. But it's looking at the potential and the potential reality that we're going to be living with COVID going forward, and the variants that we're seeing. And again, on the Medical Society call just an hour ago, we heard about these variants they're very troublesome, and where our vaccines may either have to be modified. And I had people at the COVID clinic today asking me, do I need another shot after this one? And this was a second Moderna. And I had to say, I don't know. So these are realities looking forward. So those are my two information items.
Thank you, Dr. Warner. Appreciate
sorry.
that.
Okay, Mike, do you want to go ahead with your report?
Yeah, if you guys are ready, if you don't mind, I'll share my screen and let me start up this and. Okay, can everyone see my screen? Okay, so I do some updates for everybody tonight. I do some updates on Skokie COVID-19 data. I will talk a little bit about the CDC interim public health recommendations for fully vaccinated people that came out late today. Provide some vaccine updates. I am going to talk about lead in drinking water during my my portion here, and then I know the bike safety event is later in this under new old business, but I do have one slide on that just because it shares information that people can screenshot or I can email out to the Board of Health members after the meeting. So through the 12th, we've had 6,310 cases. And I know that in the state, the number of cases are actually trending lower. But here in Skokie, it's sort of plateaued. I think that, you know, with data, with a smaller sample size, sometimes you don't necessarily see the trends, certainly at the same time as a larger sample size like the state. But we've sort of seen our numbers sort of plateau at this point. We have at 129 deaths. We still are seeing deaths in Skokie. So, as Dr. Lynn alluded to, this isn't over. And people still need to take precautions and people need to get vaccinated. Our current 7-day moving average is about 13 cases a day, which means we're contact tracing 13 individuals and their close contacts still. And we're going to continue to do that, for the unforeseen future until either A, the state takes it over or we run out of money doing it, but we're certainly going to do it moving forward. And then our positivity rate is about 3.4%. That's a 7-day moving average in the state. The Cook counties is right around 3.8%. So we're still a little lower than them. This is the latest state data showing that the number of cases, there's a trend where it's decreasing. I'm going to mute. In regards to our data, you can kind of see it's sort of plateaued, although between around May 6th and May 9th, you'll see certainly we're starting to see a decrease in our data too, which is great news. Let's talk about the interim public health recommendations for fully vaccinated people. So I believe the CDC released this information just this afternoon, where they were saying in non-healthcare settings that fully vaccinated people no longer need to wear a mask or physically distance in any non-healthcare setting. I think, not to skip ahead here, but one of the questions I have for myself, and I really am looking for the state to provide a little more direction, is if you go to the state website right now and look under the Department of Commerce and Economic Opportunity, the DCEO business guidance, they haven't changed anything. And I don't really know if this means the state's going to say indoor restaurants, no longer the need for 6-foot spacing on tables, or, no longer in restaurants the need to mask when your waiter or waitress visits your table. But I can only assume this means that people are being given a lot more freedoms if they are vaccinated. And I think we all can agree that how do you police this, really? I mean, what are the teeth behind this now? Because how are businesses going to know who's vaccinated and who isn't at this point? And what businesses are actually going to be asking people that. So it'll be an interesting week or two here to see what happens. Schools must continue to follow the CDC's school guidance until more people and children are vaccinated. And fully vaccinated people, if they are exposed, they're not required to quarantine. But if they are symptomatic, they're required to be tested and quarantine at that point. Masking is still required on planes, buses, trains, and other forms of public transportation. Like I said, my last question, that was a question I had for myself, was, how does this affect the different business types? I don't know yet. I had the library. Go ahead, Dr. Lynn.
I'm completely on board with you. I had the same questions, but I just received an email earlier this evening that White Sox Park is going to have a section devoted to people who are vaccinated. Now, to me, that's almost code like saying, and we're going to pack them in much closer. And so unless they have a reliable way, we may victimize honest people because of dishonesty on the part of people who just want to exploit this. That's just my current kind of downer mentality right now.
And my comment to that who would want to visit Comiskey Park anyway, or Bank Rate or whatever, Wrigley Field is where you want to go. So,
Mike, the other thing is that we still are under Governor Pritzker's bridge criteria, which I quickly looked at that, and there is some variation, and I think the state takes precedent over the CDC, doesn't it?
Yeah, it does. It does. And I received a text from my state regional person, Elmira, and the governor did mention that he's on board with the CDC, the new CDC guidance, and so we'll see what happens. I mean, his current order needs to be amended, I'm assuming, and other things have to take place. But I think now that the news is out, I think that the business community and others are going to more freely go about their business without masking, for sure. Vaccine updates.
Mike, another question on that though. How will the village get that message out to the various businesses?
Yeah, so I already sent it. Well, I did send an email out to the village manager and also to the Matt Brandmeier. He's responsible for the business community and the antennas. And we'll be busy probably first thing tomorrow on developing information to send out to not only to the residents, which will probably go out next Tuesday during the e-news, but also to the business community to just clarify exactly what the requirements will be. We've sort of, at every step in the process, whenever there's been a significant shift, we've provided consultation and information to the business community and provided them with a person at Village Hall to call with any questions. So COVID-19 vaccine, as you know, the FDA and the CDC ACIP have approved for ages 12 plus, which is great news. We're going to be administering the Pfizer vaccine. We have plenty of it. Actually, there's a number of providers around the state who have extra, and we are working with state. That's sort of the state's emphasis right now, is to find those providers that have the extra vaccine. And instead of distributing vaccine directly from the state, now they're starting to move the vaccine from provider to provider to make sure that vaccine isn't wasted. I think within the last week, we took a full tray of Pfizer from Maricopa County, I believe is what it's called. And they drove up all the way from Southern Illinois with a tray of Pfizer on dry ice so that we could store it here, because we hope we have a greater need than they do at this point. So Moderna vaccine, we've administered about 25,000 total doses of Moderna. So it's been pretty incredible, and I'm really proud of the employees here at the village, but also all the volunteers. I know Dr. Werner and Dr. Lynn. I mean, I'm not sure if anyone else on the call on this webinar has volunteered, but I've seen you guys there, and without the volunteer group there and professionals, we all really do respect. This couldn't have happened. So I really appreciate everyone's effort
Pat Urbanis has also been volunteering.
Well, thank you.
And
Pat.
many of the MRCs.
Oh, I've seen you. Didn't I see you you were downstairs here, weren't you? The one day?
Yes, I did that one day. Yeah.
think
But
saw
I
you.
also worked in the observation room,
Okay,
6 weeks. I did that.
well, that's awesome. Well, thank you for your help and your volunteering. So Johnson & Johnson update. So we have Johnson & Johnson, and we offered a first dose clinic last week. We had over 400 available appointments and 83 people end up showing up. So
Oh,
I think the demand is lukewarm for Johnson & Johnson because of all the media. We are administering Johnson & Johnson to homebound residents. We don't have a ton of them, but we are physically going out to people's homes, and that product is perfect for that because it doesn't require a second visit to that person. This is some of the data, interesting data in that we vaccinated, like I said, no, we haven't, but 39,000 or so Skokie residents through last Sunday, had been vaccinated, received at least one dose. And if you look at the census data, when you run the numbers, that's about 93% of our seniors, 65 and older. And I did provide the Illinois data from today that said that 81% throughout Illinois had been vaccinated. And then for 16 and over, Skokie's at about 78% of those eligible. Where Illinois is right around 57%. So again, really proud of Skokie residents for, taking advantage of this amazing opportunity to get the vaccine for free. Other vaccine updates. So we did coordinate a first dose clinic for District 219 for Niles West and Niles North this week with Pfizer. We actually physically went out to Niles West to do it. I will say for the board that field vaccinations, these larger mass vaccinations, require a ton of work. And it's something where, although we enjoy leaving our 770 frontage road, it changes things. So as much as possible, we want to continue to use this space at 770 frontage road, albeit we are meeting with the Skokie public and private schools tomorrow that serve the 12 to 15 age group to talk logistics about what's the best way to get as many children vaccinated as possible. So we'll be making some pretty important strategic decisions at that meeting tomorrow or after the meeting based upon the feedback from the superintendents from those school districts. For the week of May 17th, which is next week, we're going to have a first dose Pfizer on May 18th, a first dose Moderna on May 19th, and a second dose Moderna on May 20th. For the following week, we don't have anything scheduled, and the reason is because I want to wait till we meet with the schools tomorrow to really determine where what we'll be doing the following week. So lead in drinking water. So Dr. Warner asked me to present a little bit on lead in drinking water in Skokie, just because it's been in the news. I think that Skokie and a lot of the other older municipalities in the Chicago area have been in the news for lead. But in general, the drinking water that is pumped to the village of Skokie from the city of Evanston, it doesn't have any lead. The water mains, which bring the water to the village of Skokie and transport it around the village of Skokie, are made of iron, not lead. What's made out of lead is most of the service lines that service the homes between like the beat box or from the water main to the home. Many of the service lines that service the homes are made from copper also, but a majority really are made of lead because Skokie, because of the older housing stock, back then, that's what they used. They didn't know any better back then. In 1992, Evanston began adding polyphosphate to prevent the leaching of lead from drinking lines. And although this isn't in my slide because I don't have the data readily available, we don't see a ton of kids in Skokie that have elevated lead levels from year to year. We just don't. And in general, the Illinois Department of Public Health has communicated that the primary source of lead when it comes to childhood lead really is lead-based paint and not the drinking water. Every 3 years, we do collect 30 samples of water samples, and they're submitted for testing for lead and copper. All our water samples tested have met or exceeded US EPA standards, which is really good news. We do post an inventory map of the lead service lines, which I'll show you on the next slide. So any of you can go to the village website and see a map of where lead and or copper service lines are located. All lines were assumed to be lead if not known to be made from other materials when looking at that map. Keep that in mind. And then just based upon what I saw and from talking to Max Slankert, our public works director, is that more than 90% of Skokie water service lines are made of lead. This right here is sort of a map, although it would make me think that it's less than 90% by looking at this map, is what's copper and what's lead and what's iron and what's unknown. I'm not really sure. On my previous slide, the information I got from Bruce Jones said that they sort of assumed certain service lines were lead. So I'm not really sure why I would say unknown, but this is basically the map you find on the village website. So you can see anywhere where you have the grayish dot, those are lead service lines. So there's a lot of them in the village. So what about the complete replacement of lead service lines? Is it required? Is it realistic? Well, the village does replace the village portion of lead service lines from the water main to where the water shutoff valve is. And they do encourage private property owners to replace their portion of the service lines at the same time, but it's really at the property owner's own expense. On January 15th, 2021, EPA published the final revision of the lead and copper rule with a compliance date of January 15th, 2021. And what that said was that the village had to identify areas most impacted, strengthen treatment requirements, systematically replace lead service lines, increase sampling reliability, improve risk communications, and protect children in schools. All systems with lead service lines or services of unknown material must create and submit a goal-based replacement plan to the state within 3 years of rule publication. Well, I know that that's something that the village is working on, but I don't think it provided any specifics as to how many service lines we needed to replace within a certain amount of time. However, I'm going to skip this one and go to this. There is a House bill. It's Illinois House Bill 3739. It's current legislation about lead service line replacement. The bill is right now in the Senate Executive Committee. The bill lays out a timeline for completion of lead line and development, or completion of lead line survey and development and submission of a lead service line replacement program. This is information I got from the public works director, as he said, based on the numbers of anticipated lead service lines in Skokie's system, likely more than about, you put 9,999, maybe I'll just say 10,000. It would require Skokie to replace 3% per year with a completion of up to 34 years. It also imposes new limitation on partial lead service line replacements and creates an advisory board to take up the issue of funding of this work and implementation of best practices. So it has not been passed. I think my biggest concern with this is just the funding. Like, who's going to fund this? Because replacing even 3% a year would cost the village a ton of money. I think he was saying it would be, I'm not going to throw out a number, but it's a lot of money. It's maybe $10,000 a year to replace the service lines, or $10,000 per service line. So the Skokie Water Quality Report. So we do publish it in June or July in the new Skokie, and it's posted on the Skokie webpage. We've had excellent results over the previous years. It was last tested between June and September 2020. Like I said before, the action level is 15 parts per billion for lead and 1,300 parts per billion for copper, and we haven't been above that action level. So according to the EPA, our water is safe to drink in Skokie, and I hope that everybody feels the same way. And the next thing is the Skokie Bike Month event, but I think
Mike, I have a question about how do you select the 30 homes? Do you select homes that you know have lead service lines, or do you just randomly select 30 homes in the village?
it's a great question. I know they randomly select the homes, but I don't know, to be honest with you, that's a great question that I can, I'll ask Bruce Jones to provide a response to that, and I'll send something out to the board.
For the information to be valuable to us, they should be studying lead service lines.
Mhm.
Otherwise, how do we know for real? And how much does it cost a homeowner if they're asked when the village is replacing the main to replace the service line on their property? What is the average cost for that?
One of my friends paid $6,000.
At least if not more. You know, my street, the main was replaced in one area, and we had the run through from the water project from the Niles Water Project, if you will. And they replaced the service lines on the south side of the street, but not on the north side of the street. Of course, mine did not get replaced. And when my neighbor needed to replace some plumbing as part of a restoration in his house, he got a permit, and he also was told he has to replace his lead service line. It was.
Yeah, and I know the plumbing inspector who told him to do that, who's no longer with the village.
Yeah, and it cost him $10,000.
Pat, how much did you say? I didn't hear.
My friend who lives on
$10,000.
on Kildare paid $6,000, but that's a couple years ago when they were working on that street.
Everybody on my block that I know got a letter recently from Nicor Solutions to buy insurance to replace their service line, but I don't know if it includes this. And when I called the village to ask them what I should do about it, they wouldn't give me an answer. So what should we be telling people?
You must be a commie.
If you're asking me, I think that the best thing to tell people is to contact the Public Works Department.
Yeah.
I wonder,
Mike, if an individual wanted to have lead testing for their water, how is that available?
Yeah, anybody that wants lead testing for their water, there's, I believe on the village website and/or, through the village, we can provide you with a list of labs to conduct the testing. It's not something the village though would provide for homeowners.
but I agree with Mike. In a former life, I defended homeowners who had renters whose children had lead poisoning, and it all came from the tracks in the windows, because you can replace the paint on the outside, but you can't replace the tracks, and the dust gets all over the house and it gets into the children, and it's profoundly damaging to their brain.
Yeah, a few years ago, we had a presentation by, I think, Sue Riesberg on lead poisoning in the village. And it was, as you said, Maureen, it was really all the lead residual in the windows and not really with the water situation.
So when my granddaughter moved in my house, I replaced all the windows, so I wouldn't have to deal with that because she was 3.
And I've been a state licensed lead assessor for probably, I don't know, maybe over 20 years, 20 some plus years. So I've done a ton of lead assessments, environmental lead assessments at properties. And we usually find it in the frictional surfaces and exterior window components, because that's where you find that between the sun and the wind and the rain, it really deteriorates the paint and the frictional surfaces. You certainly see it a lot. And I found it in all sorts of crazy. We found it in jewelry before. We found it in spices.
Wow.
Sometimes you have to detect it to figure it out, but you know, typically water is relatively safe. You know, we always say if you're on a vacation for, you know, a number of days, the recommendation would be to just, when you get home, run your water for 5 minutes or so, just flush it out a little bit, just because you could have some settling, but in general. And if the village does water main improvements, they will provide information to the residents affected to flush their water. But in general, the water is pretty safe.
Okay, thanks, Mike, for that.
Thank you. Did you want me to start that slide up again about the Skokie Police Department's National Bike Safety Month?
Yeah, please do that.
Okay. Okay. Can you see the slide? I'll make it a little bigger. Is that big enough, or is it too small on your screens? I can start this and do this. Is that better?
Yeah.
Okay. So I know Dr. Warner and the Board of Health has an interest in bike safety, and the police department is partnering with the Park District to offer a National Bike Month event on May 23rd. So the police department is going to be doing some bike safety courses, and local bike shops to be on hand, and it will be outdoors. And I just wanted to share the information with the Board of Health and mention that if anybody's interested in volunteering for the event, they could use 2 volunteers. And I thought, who better to volunteer than don't you volunteer enough, Dr. Lynn? Jesus.
I'm a bike rider.
I feel somewhat responsible because I kind of brought this up when I first joined the board last year, because I've been very concerned about the increase in bike riding and the decrease in helmet use.
Yeah.
And I consider myself, I'm not as active as I used to be, unfortunately, but I spent a lot of time recreational cycling, and so I'd be more than glad to help out in this effort, because it's a cause that's near and dear to me.
I'll volunteer too, Mike. I'm a bike rider.
What I can do is send, okay, so I got Maureen, I got Dr. Lynn. What I could do is I'll email you guys this information, and then maybe you can connect with this Officer Wilkin. He's sort of down at the bottom of the slide. Officer Wilkin is the person that will set you up, and I don't know what they'll have you doing, but you know, I think it's a great event. It's outdoors. Hopefully it'll be sunny and 70 degrees. So, do you have anything else to add, Dr. Warner?
No, I don't. But thanks for the follow-up on this. You're finished with your director's report?
I am.
Yeah. I wonder if it would be timely for us to take action now, since it looks like we have a quorum. There are 2 action items, one around the agenda and the other around the minutes. And since we're using a consensus approach, does anybody have anything to remove from the agenda, although we're more than halfway through, or from the minutes?
No.
Seeing none, then they're approved as published. Okay, and Mike prepares these, so again, thank you.
But you can blame me if they're horrible.
I think we have one other item to discuss around the tobacco issue.
Yeah, did you want to say something first, Dr. Warner, or can I jump in?
Well, as you recall, I think it was last fall that we sent a letter to the village trustees and administration around the issue of tobacco products and flavored tobacco products, and recommending that those be controlled. And in rereading this, I think we have a nomenclature problem in that we did not mention the non-tobacco electronic systems that are flavored. They're a nicotine delivery system, but they don't have tobacco. And the way our letter was written, I think there's some ambiguity around that. So I just wanted to bring that up. And Mike, that may be something that we have to work on and get that more finely crafted. And with the minutes, Mike sent out a copy of what Oak Park had passed in quite detailed. And I don't know if that would be a model for us to use or not, but it certainly was in like you said, a great deal of detail.
And if I can elaborate just a little bit on what Dr. Warner just mentioned, is that the letter that went to the mayor back in October, the subject itself was Skokie Board of Trustees urged to halt the sale of flavored vaping products.
Mhm.
And what I was curious about is that is the Board of Health was the Board of Health interested in banning the sale of flavored vaping and tobacco products, or only interested in banning the sale of the actual vaping products? Because when I was in Oak Park as the director, we went ahead and banned the sale of both. And and we took that initiative because we thought it was important that across the board, the evidence showed that the flavored products were being used more by younger individuals, really between the ages of like 12 and 18. And if you could prevent that age group from getting access to those products at an early age, that it would reduce the likelihood that they, whether it be a vaping product or a flavored tobacco product, it would significantly reduce the usage as they got older. So I just needed clarification on whether or not I got one. I would like to ban the sale of both. Dr. Lynn said both. So
I agree with Dr. Lynn, and I know there's an activist group in the city now trying to ban menthol flavored cigarettes.
yeah. So I would recommend that we come up with something to vote on tonight that clearly outlines what the Board of Health recommendation is. And I'd recommend something to the effect of the Board of Health is recommending that the village ordinance is amended and that tobacco ordinance to ban the sale of flavored tobacco and flavored vaping or e-cigarette products, including flavored products and menthol flavored products, if menthol should be included, because sometimes they differentiate, especially when it comes to the tobacco lobbyists and the tobacco industry. They'll say, well, menthol's not flavored. So we need to make sure that when the village board directs the law department to draft an ordinance, that it includes everything that the Board of Health has recommended.
And I think the mention of a flavored vaping product includes those nicotine delivery, not the nicotine delivery items that don't necessarily have tobacco in it. But I don't know if Mike can make a motion, but it sure sounded like a motion. Would somebody like to affirm that, and then we'll vote?
So one of you guys has to do an initial. One of you guys has to say, I'm going to
I move.
initiate it first, whatever Mike said or something, just to make it official, because I can't do it as a staff member. I don't think I can do that.
I so move.
All right. And a couple people raised their hands, so second. Is there more discussion about this?
The 4 people on the chat room who also agree. The ban bill.
Okay.
Dr. Lynn?
Yes, I agree with both.
Dr. Lynn?
Yeah, I think focusing on cigarettes and the vaping products is the way to go. Unfortunately, it's been many years since I even went into a tobacco shop, but I know that a lot of pipe tobacco, they won't call it flavored, but they put volatile compounds in it, which, again, they argue, well, I'm not inhaling it, but the reality is it's being blown off into the room, so people are inhaling it secondarily. And I don't know what's going on in the hookah lounges, since it's not something that I tend to visit. I think we have to start somewhere, and I think we have to start with those that we have clear scientific evidence that these are problematic. And I just want to clarify that there's going to be, like you mentioned, the tobacco industry, Mike, there are other products out there being used different ways.
Dr. Shim, you had a comment?
Even the products that they advertise as non-nicotine, studies have found that there are nicotine in them. So that the teens who are using these flavors are the ones who are addicted eventually. And as we know, as little use as 2 weeks is all it takes to be addicted. So I am all for banning both flavor vaping as well as cigarettes.
All right.
Yeah. That's great. So next steps, what I'll do is I already submitted a memo to the village manager. I'll revise that memo and I'll clarify exactly what was voted on tonight and approved. And just to reinforce the Board of Health's recommendation. And then the plan is either June 7th or June 21st for Dr. Werner and I to present to the village board, the Board of Health's recommendation. And hopefully, in response to that, the village board will direct staff to generate an ordinance that the law department would generate, and then it would go back to the village board for a vote.
Okay, thank you. Thank you for catching that inconsistency, so we can move forward. I'm wondering, based on Dr. Lynn's comment, if we should, as a board, take a field trip to a hookah shop and just see what goes on. All right.
Who is going to go?
We're toward the end of the agenda. Mike, are there any public comments?
Let me check. That's a great question because I did not. There is not any public comment, Dr. Warner.
Okay. And any idea when we might be able to meet again as a board in person? Anything from the village yet?
I don't have any updates on that at this point.
Are we all vaccinated?
Nah, I am.
Yeah. All right. So we're at the end of the agenda. Unless there is some other item to raise, is there a motion to adjourn? Okay, I see a second. And
I do.
all right, all in favor of adjourning, and this is before 8 o'clock, so we do well. All right.
We do well.
We did.
Great. I got softball at 8:20, so maybe.
Okay.
Thanks, guys.
All right, thank you all. See you next month.
All right.
Bye-bye.
All right.
you.
Good night, everyone.